Hello, welcome to abekamultimedia. This is Fit Matters. Yes, are you fit? It's a deep question, you know. When you are not strong, you won't be able to achieve all the things that you're supposed to. So you need to take good care of yourself and be strong. That is why Abeka Multimedia, we there for you. We said we are going to give you nothing but the best, and indeed, we are giving you nothing but the best. I'm your favorite, Nanefia Asantua. Fit Matters. Today we are going to talk about drug abuse. Yes, how most of us, when we are having headache, we say malaria, then we go and buy any medicine, then we take. Yeah, we'll be talking about it all, and the beautiful nurse Miss Benedicta Oredu is going to give us a lot of education on drug abuse. But before that, let me go for a quick turn. We'll be right back. Welcome back. You're still watching Fit Matters on Abeka Multimedia. As I said earlier, we'll be talking about drug abuse. The manner in which, most parents and then even the youth, you abuse drugs these days, it's so not cool. You guys have to, be educated so that you will know what to take at a certain time and what not to take. Miss Benedicta is here to take us through, to educate us, and then give us a lot of insights about drug abuse. Miss Benedicta, you're looking good.
Thank you very much.
Oh, like that. You are just shining like that. What is your secret?
Well, my light skin, is my light skin, yeah.
Oh, yes. I have to. I need to change mine, and then also,
It's a lie, you'll get it.
I won't get it. Yeah, so we are looking at drug abuse. The manner in which we take some paracetamol and some Javidos and the rest is so not cool. You know, when we are having a headache and you tell your mom, because I got para no. Is it right?
No, it's not. Medication. This whole drug abuse thing, it's a headache for me actually. It's something I talk about a lot. I talk about this a lot to my patients, my peers. I talk about it a lot. It's anyone who knows me knows I've at least mentioned just buying medication anywhere for anything. Yes, I've talked about it a lot, and it's a big headache for me actually.
Oh, don't worry. Very people will get to understand, and then I'm sure it will reduce.
I hope so.
Yeah, it will reduce. So when we talk of drug abuse, what do we mean by that?
Well, it's two words: drug abuse. A drug is any chemical that can change the way the body works. That's basically it. Any chemical that you take in, whether to your mouth, to the skin, to your nose, anywhere, that will change how the body works. And abuse is abnormal use. Using a drug in the way that is not supposed to be used. That is drug abuse. You can either use it less than it's supposed to be used or more than it's supposed to be used, or you can just use it in the wrong way. It's all drug abuse.
It's all drug abuse.
Yes.
So is there a connection between drug abuse and drug addiction?
In mass, they'll tell you that there's a subset in there.
Yeah.
Drug abuse actually leads to drug addiction. Yes. Addiction is a disease. We don't look at it as that way, but it's a disease. It's actually the drug changing the way your brain works to make it dependent on the medication or the drug that the chemical in question. So drug abuse can lead to drug addiction. Yes.
So what are the causes of this whole drug abuse?
Well, the first one at the top, when we are talking about the recreational drugs like cocaine, heroin, weed, those ones, the highest cause will be pressure.
Okay.
Peer pressure, societal pressure, house pressure, school pressure, country pressure, economic pressure, all the pressures. It will be the top.
Yeah.
But then if we are talking about the non-opioids, non-recreational drugs like para, our favorite.
Yes.
Para. Everywhere.
Everywhere you go, like MTN.
Para. Paracetamol, for example, these medications that can be prescribed, the biggest cause of abuse is improper information.
Okay.
Wrong information, in fact, our patients don't listen. Sometimes you explain to a patient that you have to take this for a whole 7 days. They take it for 3 days. They are fine.
Yeah, okay.
That is it.
That's all.
They won't take it anymore.
Yeah.
Then also there's I mentioned the pressure. The pressure is there. peer pressure. Then also, if there's family history, if you've seen your parents doing something, you grow up and
do it.
When I was younger, I told myself I will not shout like my mother. But now
you shout.
Oh, I'm my mother's twin. So if you see your parents doing things, if you see your siblings, your older siblings, your older cousins doing things, you will do it.
You do it.
You even if you make a conscious effort not to, you will find yourself wanting to do things like this. So there's also family history that can also cause that. Yes, these are like the main causes
of drug abuse.
Yes.
Now let's look at Ghana. When we are talking about this whole drug abuse issue, what drug is actually, I mean, the most abused?
Before you even finish para.
You see, so looking at it, like basically, para is a major problem.
Well, painkillers in general, actually.
Painkillers
in general. We don't really respect caffeine as a drug.
Yeah.
But caffeine is really abused in Ghana.
Yeah.
Someone would sit behind this and say, I don't even take caffeine. Rush Energy. Monster Energy. Power, and then they have so many energy drinks in the system.
Yeah.
Now they drink it. You see especially the church drivers and the maids eating
that's
with pie.
Take. Yes. Energy
Rush and pie.
Serious oh.
Rush and pie.
What a combination.
Rush and pie. I talked to one driver I was in the bus with, and I was asking him if he knew the effect of the too many energy drinks. He says he can take 3 in a day.
Whoa. For what reason?
And then so caffeine, pain medication. Para is the one we all know, so I'll use para as an example. I don't want to mention any medications and get people aware and get on them.
Yeah.
Please. So pain medications, caffeine, then the ones that they always use in examples, weed. Marijuana. Marijuana is also abused. Cocaine. I used to think there was no cocaine in Ghana.
Whoa.
Yes,
but there is.
That's why I say used to. I used to. Nursing has taught me a lot.
Okay.
So yes. So these opioids, when we say opioids, they are medications that are gotten. It's a whole lot of. Yes, I don't need to go into that. Yeah. But opioids are also really abused, especially among health workers. Yes.
They do that.
Yes, opioids, especially among health workers. It's a big problem in the health system actually. Yes.
So is it because of lack of education, or what actually? I mean, will make someone do that? Is it that our system, or let me say the Ghana Health Service, they are not doing, a proper educational thing for the general public to understand what they are supposed to take and what they are not supposed to take?
You see, drug abuse is a very sensitive issue when we are talking about it among patients and all. It's actually a very sensitive issue. The Ghana Health Service is doing their best, but you can't go into someone's room and tell them not to take a particular medication or drug. Whenever a medication drug is prescribed, we are supposed to give proper education on the medications.
Okay.
Now there are people who don't wait for the education. There are people who don't want the education. There are people who hear it and it comes out.
That's all.
Of this. There are also campaigns around on drug abuse, drug addiction.
Yeah.
There are campaigns on those. There's I think almost every district or municipal health center has a ward or a place center for psychological issues like this. I worked personally with the one at Akawe. That's Wejagbawe Municipal Hospital. I worked directly with them, and they have days where they go into the community and talk to people like that. Some of them know the druggies, the people. They know them and they talk to them. So we are doing our best. Actually, Ghana Health Service is doing their best. But you can't get up and go into someone's room
and tell the person that.
When we were talking about the causes,
peer
pressure.
Oh,
I want to be like a friend of mine.
Of course.
there's this guy who is getting all the girls, and he does this. He's on the shisha like a dragon. So you feel like, okay, maybe that is what is getting him the girls. So I also want to do. And when you are doing these things, you will get some of the girls. You will get them.
Yeah.
So you might attribute the well, not you, but a lot of our young people are attributing drugs with being cool.
Yeah.
I feel like, yes.
It's me take it way cry. I want to mean take it.
Thank you. And then because of the high that the drug gives, you think you're on the right track. Because who doesn't want to be happy?
Everybody wants to be happy.
It's the medication. In fact, the drug takes you high.
It takes you higher.
It takes you high. I talked to some of my people, and then I asked them, why do you take these medications? Why do you take these drugs? What does it do for you? By the time he was done with explaining how the high feels, if not for the fact that I knew the effect, I would have gone for it. I would have become a convert.
So that we all go high.
We all go high.
All right, so let's look at the treatment. I mean, in Ghana, would you say that going to the hospital is costly? That is why people tend to also look elsewhere, or they don't even go and check. They just go and buy any medicine and they'll take.
Well, well, I believe that it's again lack of information.
Okay.
It's a fact that some treatments are expensive, but then there are a lot of big hospitals that actually still take the national health insurance, especially 37. They take the national health insurance, like they take the insurance, and then there are people who come to the hospital, don't pay anything. They don't pay anything. Maybe for drugs, that's medications, or just labs that they'll pay for. And I do admit that some of the treatments are expensive. But then I believe most of it is lack of information. Seeking help, one of the biggest hurdles is not actually the price of it, it's more of the stigma. When you meet someone who obviously takes drugs, what's your first reaction to the person?
Oh, come on.
Don't come near me. You see, those things like that, they're actually part of the reason why a lot of people don't seek help. And some of them feel like they don't, as I mentioned, lack of information. They don't know what they're doing wrong. They don't feel what they're doing is wrong.
So, all right, let's look at it before we wrap up on it. We actually have to come back and do a part 2 for us so that we can touch on those that we have not been able to touch on. Talk about the effect of it on us.
Effect of drug abuse. It's plenty. It's plenty. The main one is we usually look at the physical effect on the person. You might get kidney issues, you can get lung issues, depending on what drug the person is abusing. You can get a lot of health problems. We only mostly look at the physical effect, but we don't look at the societal effect. What does you abusing drugs or you using drugs in the wrong way, how does it affect your family? How does it affect your church? How does it affect your community? You see, drug abuse in the long run is more expensive than going to the hospital.
Wow.
For example, you were on para, I have malaria, para. You didn't even test for malaria, but you said you have malaria. You went to buy malaria medication, and then you bought vitamin C with the malaria medication. That's the combination, but vitamin C actually what's the word? It reduces the efficacy of the medication. So you are literally just chewing chalk. When you take malaria medications with vitamin C. But then you didn't go to the hospital. So they gave you a malaria medication that you bought it, and then you bought vitamin C, and then you are drinking orange on top of it. No problem. You chew your chalk. After you finish chewing your chalk, whatever the actual problem is, for example, it probably was a stress headache. So you probably need to sleep. You did it. So you took the malaria medicine. The pain is still there. You went to work, and maybe you work with children. You shout at them, and then they don't want to learn. then in that it just keeps snowballing. It just keeps going. It doesn't end. When we talk about drug use in medication, drug use in pregnancy,
yeah,
you think that there are no druggies that get pregnant. They get pregnant more than
wow.
They use the drugs while they are pregnant. They affect the brain development of the children. The children grow up and they can't learn. They can't do basic things. They can't talk. They can't walk on their own.
All because of the drug abuse.
Whose problem then does the child become? You can't take a trotro with that child, so you have to go with taxi. Which one is more expensive? Then even taxi on the side, you have to take this child to a special school just because of maybe one shot or something you took.
This is interesting. I'm really loving the whole discussion and all that. But I just have to wrap up. In fact, part 2 will have to come because I want to learn. I want to get more. You've really touched on so many, and it's very, very important. Most of the people are not trying to learn. They don't listen to our nurses, our doctors, and all that. It's like they want to do whatever they feel like doing.
They say we are worrying them.
Yeah, it's like the norm. Oh, my mom used to take para, she'll be fine. My dad used to do this, and it's really interesting. You will have to come back for part 2 and do this for us. Before I wrap up, what do you have for people watching you, the general public?
Since we are on drug abuse, I would like to talk about self-medication. Please and please again. If you are sick, go to a health worker who can prescribe medication. Don't prescribe it for yourself. 1. 2. Don't share medication that have helped for you. That have helped you. What might help you might be detrimental. It can hurt the other person. The medication that helped your headache to go might make someone's headache worse, or it can even cause. There are people who are smoking weed who are not gone mad, and there are those who just took one puff and that was it. They shared medication. These things are very problematic. And then we have to learn how to identify the signs of drug abuse. They don't always get up and then they look like someone who is on drugs. They start with signs, like they start isolating themselves from human people. They start going out in time that their behavior changes. The person was very quiet, all of a sudden is talkative, or was very talkative, all of a sudden becomes quiet. All these changes, please, when you see, keep an eye on your people around you. But then when you see signs like this, don't just attack the person, and don't judge. You don't know somebody's situation. You don't know why the person is doing what they are doing. Don't judge. Keep an open mind. Be tolerant, and please try to seek help for the person. We have this myth in drug use where people think that someone has to want help before you can help the person. But a lot of these people are taken by force to the rehab center, and then they even finish the treatment regimen faster than some people that came on their own. So please, when you see some of these signs, she said we'll come on a part 2. Don't worry. Me, if you give me the whole day, I'll talk.
Yes, we will definitely.
If you see these signs, please, don't judge. Don't be hasty. Thank you very much.
Thank you so much, Miss Benedicta. In fact, I've really enjoyed the education. I want more. So you'll come back for part 2. Thank you so much. You watching, I believe you've learned a lot from everything that Miss Benedicta has shared with us. Please, we are begging you, don't judge. Make sure that you open up your mind and you help people who actually need it. When you see something like that, don't try to pass those silly comments that most of us in fact, we should stop it, please, so that all of us can be very, very strong and fit to achieve what we are supposed to achieve. I am your favorite, Nanefia Santua. It's been Fit Matters on Abeka Multimedia. Have a nice day.